I have some details about what it is that we do, so we can get into that.
Okay, great, Jessica.
Good.
Nikki, do
Brenda.
you want to introduce?
Brenda, why don't I just open the meeting and we can sort of do, we got to do a roll call anyway. so
Perfect, great.
We'll do that. Okay, I've got to find everything. So I'm calling the meeting to order at 3 o'clock. And I'm going to adopt the agenda as submitted without any changes. And public comment, I'm assuming there's no public comment because there's only our commissioners and Jessica. And so I need to move open session minutes. We'll approve minutes later, but I need to read the latest version of the script, which is pretty long. So here we go. Okay, public participation. We are using Zoom for this meeting, which allows for the public to participate in the meeting as an attendee. The chair can request that members of the public provide their names for purposes of keeping accurate minutes of the meeting. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feeding for this meeting. Attendees will join listening mode. They can click and raise the hand button if they wish to speak. The chair will call on those who have raised their hands in the order they were raised. All questions should be directed through the chair. As a preliminary matter, this is Mickey Rowland, chair of the Nantucket Commission on Disability. Permit me to confirm that all members and persons anticipated in the agenda are present and can hear me. When I call your name, respond, staff. So, Georgia.
Yes, I'm here.
Okay, Jeanette,
Here.
Mary Beth,
Here.
Augie,
Here.
and Brenda as the commission facilitator.
Here,
All right, so everybody's here. So this meeting of the Disability is being conducted remotely pursuant to Chapter 2 of the Acts of 2023. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment for this meeting. Commission on Disability is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. Please note this meeting is being recorded and all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and take care not to share your screen on your computer. Anything you broadcast may be captured by the recording. All supporting materials that are provided by members of the body are available on the town's website unless otherwise noted. The public is encouraged to follow along using posted agenda unless I note otherwise. We are now turning to the first item on the agenda. Permit me to cover some ground rules. I will introduce each speaker on the agenda. After they conclude their remarks, the chair will get on the line of members. Blah, blah, blah. Please remember to keep your phone on mute, speak clearly, state your name before speaking, try not to talk to each other or talk to the chair. And for items with public comment, which we're not doing, I'll skip that. Okay, that's it. Thank you, everyone.
I think there's just one thing, Nikki, the anticipated speakers on the agenda.
Okay, Jessica, yeah,
Yep, Jessica Simmons.
Jessica Simmons. Okay. All right. So why don't we let Jessica go ahead and present? Does that sound good?
Sounds good to me.
Great, thank you.
So, hi, everybody. It's good to see you all. So I'm Jessica Simmons. I am again, program manager here with CORD. I don't know if any of you have heard of CORD and what it is that we do. So we stand for Cape Organization for Rights of the Disabled. We've been around since 1984, and we are what you call a CIL, or a Center for Independent Living. We are one of 10 in the state of Massachusetts, but every state in the U.S. territory has a few CILs. So we're what you consider consumer controlled. So basically when a consumer comes to us for services, they pretty much control the services. They decide, what the things that they need to work on. And we try to help facilitate that in the most accessible manner for our consumers. It also means that we do not take third-party calls. So when somebody comes to us for services, that's exactly it. They need to come to us. We're run by people with disabilities for people with disabilities. So 51% of our staff and board are individuals with disabilities. And that's actually how we receive our funding from MRC. Despite our name, Center for Independent Living, we don't actually have any housing of our own. We don't manage any housing. That's a common misconception, unfortunately. We serve all ages, all incomes, all disabilities. We do not require proof of disability. You don't have to give us, a letter of benefits from Social Security Administration or anything like that. There's no charge for our services. We're a 501c3 nonprofit. So I want to do a quick overview of some of the programs that we have, and I'll start with the youth services. So we have our first youth services called TAP. It's Transition to Adulthood program. And that's for individuals in the between the ages of 14 or 21. You must have a disability. You must be in high school. And it's a service that we provide that helps 14 to 21-year-olds get ready for life after high school. It's also skills training and goal setting and helping people understand what their rights are with the education system, IEP support as well. We don't write IEPs, obviously the school does that, but a lot of people are just unaware of what their rights are when it comes to the schools. And helping people, get their input in, make their wants and needs known. And also with accessibility within the schools and getting assistive technology. Most of the time the schools actually are supposed to provide that. Some people are unaware of that, so we can help advocate for that. And we also teach the kids advocacy skills so that they can advocate for themselves on their own. And then we have the work readiness and prep program. It is the same age group, 14 to 21. It's kind of like a pre-ETS program, pre-employment transition services. So again, you must have a disability and be in high school or post-secondary school, college. Some of the pre-employment skills training is why work, career exploration, workplace etiquette. We actually provide workshops that, can teach these young individuals what is appropriate in the workspace, how to build a resume, how to interview. We can do mock interviews. That's always a fun one. So teach them about staying safe in the workplace and disability rights in the workplace, again, with reasonable accommodations and accessibility in the workplace. And I tend to speed talk, so if you need me to slow down, just again, how to advocate for yourself and getting ready for college or trainings. And then we do limited short-term internships. So we do have a couple of companies around the Cape and the Islands that will provide internships, and we actually pay the students. So the employer is not paying them, we are. It's a paid internship, but it really helps. It really helps these young adults get their, their foot in the door in the working world. So some of the adult services that we provide, we have options counseling. So it's anybody 18 or over with a disability or 60 and over. And that is short-term decision-making for long-term goals. So if, say, somebody in their family is telling them, oh, you need to be in a nursing home, and that individual does not want to be in a nursing home, they want to stay in the community, we can help people look into their options and decide what's best for them. And if they decide they want to stay in the community, okay, well, we can help you figure out what is it that you're going to need to help facilitate that. Whether it be PCA services or assistive devices, things of that nature. Our VRIL program, it's vocational rehabilitation. So that's when we have referrals directly from MRC. Usually they're providing employment goals for that individual, but they just need a little bit more. So we get the referrals directly from them and we go out to them and we can help people that way. We help people with independent living goals, housing, applying for benefits, SNAP benefits, disability benefits. That can be a daunting process for a lot of people, especially housing. We're in a crisis right now. A lot of people, they need accessible or affordable housing, don't know where to start. So we can help them start navigating that process, help communicate with housing authorities, and even help communicate with landlords, because sometimes those can be tough relationships. So in my department, the independent living department, like I said, we are the biggest department at CORD. We serve all ages. So if you have any individual that doesn't fit into one of our youth services, we provide services from birth to death, all ages. What we do depends on what people's needs are or what they want. Again, with the skills training, and if somebody say needed to learn how to navigate the bus routes. If that's part of their independent living plan, you know, we can help facilitate that. Discrimination in the workplace is another big one. We can help people, you know, if they need to file a complaint or they just need help facilitating a conversation with their employer. A reasonable accommodations is another good one. You know, if somebody needs some sort of accommodation in the workplace and don't know where to start, we can help navigate that process. We can help people get assistive technology, and that's a big one. People don't realize how many adaptive devices are actually out there. I mean, everything from memory aids to helping somebody dress, just complete activities of daily living. There's so many things out there. And we actually do have funding that can help people purchase those if it's not covered by insurance. We can teach about employment rights, help find resources. We provide community workshops. So right now we're running a workshop for housing. We can help people get started with navigating the housing process. And we have a new one that's up and coming called Stretching Your Dollar. So it's a budgeting skills workshop. These workshops are always free, and anybody that you think may need them can always just come by. And right now we're doing the housing workshop the second Wednesday of every month at 2 o'clock. The budgeting one, I'm not sure what day and time that is yet, but you know, if you guys want that kind of information, I can surely send it out to you. You can check out our website. We provide technical assistance. So if somebody say needed a magnifier or even needed a workshop, an employer had somebody that had a disability and the employer needed to learn how to, you know, help their employee use these kinds of devices or doesn't know how to facilitate that, we can do workshops on that too. We do community advocacy with housing, aligning ADA and AAB, Americans with Disabilities Act. Mass Health Estate Recovery was a big one that's come up lately. I'm not sure if you guys know what Mass Health Estate Recovery is. So it's any member that has Mass Health after the age of 55 is this estate recovery kicks in, where Mass Health actually, after somebody is deceased, can go in and take somebody's estate and it's like a buyback almost. Like if any services that are provided by Mass Health from the age of 55 and over, Mass Health can actually take that money back out of somebody's estate once they're deceased. And a lot of people that are on Mass Health are not aware of this.
Wow.
So yeah, it's been a big issue. We're trying to push for change. And there has been some changes, but it's still, we want more. So we work with a lot of state representatives on, you know, legislative issues like better accessible transportation, obviously housing being the other big one. So those are some of the other things that we do within the community. Any
Can I ask
questions?
Quick question.
No, that's
Mass Estate
yeah.
buyback. Program.
Estate recovery.
This recovery. Could you explain that one more time? After when someone's over 55 years old, they're actually paying for their services from Mass Health?
No, nope. So if you're a Mass Health member, once you turn 55, any services rendered through Mass Health, once the Mass Health member is deceased, they can go after your estate.
After they're deceased.
Yep.
How far back does that go? Like 5 years, 10 years, 20 years, or just
From
however
55
much?
on. From
No, but
55 on.
After you're 55, but if you've had services up until then, they can't take back the services that you're saying they can take your estate to pay back all the stuff that they ever paid you for however many years you were on Mass Health.
No, just from 55 on.
Okay.
Okay, so
And it would be
if they die at 55, then there won't be anything.
Yeah.
Right. So if they die at
Essentially.
65, then you got 10 years of
Yep.
payback. Gotcha. Okay.
essentially. And they're not the first ones that are allowed to
Yeah.
go into the estate. They're usually at the bottom of the list, but yes, it is a law, and yes, I can do that.
Okay.
And what
It's-
does your group do? Do they help alleviate that or prevent it or just?
It's a federal law, so it's not something that we can entirely alleviate, but we have been advocating for, you know, changes to the law. so that, they're only allowed to go after so much, and actually, if you've somebody that's under the age of 55, but they have been living in a nursing facility of any sort, they can count that as well. So that's the only exception to the before 55 rule, is if somebody was living in a nursing prior to that. So there was a bill put into place last year, but it got into the legislative list a little too late. So nothing got passed, but they did make a couple of changes the year prior to that. There were minor changes, like having a hardship waiver. They put that into place. There was a couple of other things I can't remember off the top of my head. So just trying to change some of the rules around that to help alleviate it a little bit. But yeah, it's definitely something to look into. A lot of people are very unaware of it.
Yes.
It's
How
scary.
do people become aware of it, Jessica?
So that was part of the rules that they changed the year before last, was they have to notify members. I think a year before they turn 55. So Mass Health themselves will reach out and let you know that that's happening.
Right.
Just what you want to hear at the end of your life, right?
Yeah,
Yeah.
exactly.
Yep.
Exactly.
Yep. And here we are targeting the most vulnerable population with things of
Right.
this nature. And people are on Mass Health for a reason, but so yeah.
So you said that was a
We-
federal law that they can, even though it's Mass Health, you say it's a federal law that triggers that they can go after your estate, a portion of your estate after you decease, to pay for the services that you received since you turned 55.
Mhm. So Medicaid is federal, Mass Health is state, and there are state and federal laws.
Got it.
There are both.
Jessica, there's something I wanted to ask. So like, you were talking about like seniors that wanted to live at home. Like, so what kind of services do you offer to keep a senior person at home versus going into a nursing home?
So again, that would be under our options counseling. And we have a goal that's called a CSO9, and that's a diversion goal. It's just making sure that the individual has the services in place that they're going to need to remain in the community. Like I said, whether that be PCA services, or there's other programs that we can connect them with, like caregiver homes, the adult foster care program, making sure that people have what they need in their homes, adaptive equipment, devices, things of that nature. And make sure that, they're living at home risk-free. Safely.
Nantucket is kind of a special place because it's not, you guys can't just drive over and visit any of our
Yeah.
local people. How does that work for, do you ever send people to the island to help coordinate these services, or help people pay for transportation to you to get those services? Does that work?
We don't provide any sort of tangible items. So like I said, the only time that we can help fund something is assistive technology or adaptive equipment. And it's what you call Title VII Part B. It's a very dry subject, but and there's a couple hurdles you have to go over before we can provide that. But other than that, no, for transportation services, unfortunately, we can't pay for that. But if we coordinate it well, we can send advocates out to the island. I know we do go out to the vineyard occasionally. We work with Martha's Vineyard Community Services often. So yes, if there is a need, we can do that.
Have you done it? I mean, is that something that you do regularly or have done much at all?
A couple times a year.
Okay.
Yeah. And like I said, coordinating it is kind of difficult because if, we're going to send 2 advocates out to the island, we want to make sure that we can try to see all of our consumers on the island during that time.
And how are people that might be needing these services made aware of them? Like, are you in touch with the school system and
Yeah. Doing this,
Good.
trying to get out to all the, so I'm a full-time member for the Yarmouth Commission on Disabilities. We all try to be active in our communities. We do a lot of Chamber of Commerce networking events. We, Cape Cod Young Professionals is one that I'm a member of. And yes, coordinating with the schools, talking to the schools. We actually did a info table at Martha's Vineyard High School in March. They had an event and we were there. So yeah, we get out there, get out in the community, do info tables, do outreach, make sure that people are aware that we're here.
How
Mhm.
large is your department? Like, how many people do you have working where you are, Cord, on the Cape?
How many people in the office or how many people in my department?
And you're in the department who are basically doing this work. Just wondered about the size of it.
Okay, so for TAC, we have 2 advocates. That's one
Okay.
of the youth programs. The other youth program, we have 2 advocates. They're
Okay.
much smaller programs. For my program, which is IL, we have the options counselor, nursing homes transition, and then 3 advocates.
Okay, that
Yeah.
gives me a good idea. Thank you. Yeah. Okay.
And that was one of the other services I did not mention was nursing home transition. So if there is somebody that is in a nursing home and wants to transition out and can safely do so, we'll help facilitate that. You know, we work with the social workers in nursing homes and
Right.
other services, and we kind of, do wraparound services to get the person out.
And why is this not being done yet in Nantucket? Is it a lack of asking for the help? Or is it just that we didn't know about this?
We have been working on, we cover both islands and the Cape. So Dukes County and Barnstable County.
But you
And
Nantucket County.
is it Nantucket? I thought it was Dukes.
No, it's
With Martha's
Nantucket County.
Vineyard, it's
Okay.
Nantucket County.
Okay, I see. My mistake. But yes, we serve both islands and
Gotcha.
service area. So we have been out to Nantucket. We do provide services out there. Like I said, it's a little bit more tricky to coordinate it, but we can make it happen.
Everything is more tricky in Nantucket.
Yeah.
Yeah, no, we would definitely like to get out there more often, and we do have a little bit of a harder time finding a client base on the islands, but
Really?
Elder services. Would you go through elder services at all? They're a separate unit.
oh, so we're part of the ADRC. We actually have a contract with Elder Services. We work with them
Okay, so
often.
with Cherry Hunt, okay.
Yep. Absolutely. Yeah, we send referrals back and forth all the time, actually.
You think that setting up like a, just a visit to the school system and advertising that ahead of time and throughout the whole school structure, do you think you'd get much of a response in attendance? If you were to have somebody go over there and do what you're doing right now for us?
Yeah, but unfortunately with the schools, that would not be me. That would be the youth services programs.
Right.
Yeah.
And, if they were gonna do, an informational, they're not just gonna show up at the school and say, hey, here we are. But if the school was, say, putting on some sort of event and we did a youth employment service program, that happened in Barnstable, but something similar to that, we would absolutely get out there.
Our hospital has a health fair every year, so maybe that's something that you could get on.
Oh,
And they
good to
have tables for
know.
different programs.
Yeah, absolutely. That's great to know. Thank
That
you.
would
Do
be-
you know whenabouts that is?
I forgot. Do you remember?
Say again?
When is it? Do you remember, Jeanette?
I don't.
Season,
I
is it?
think it's in the fall somehow. Maybe.
Yeah, I think
I
you're
will.
right.
Fall is
That's
fine.
right.
I will look into that. Thank you very much.
You're welcome. I don't know who would be in charge of it at Nantucket Cottage Hospital, but that's.
Right.
Hmm?
You probably could even find that out on their website, I would think, maybe.
Probably.
Yes.
We were actually just had an informational table at the ECM Council on Aging. They had a health fair.
Okay.
It's a great event. Good
Yeah.
turnout.
And a lot of Nantucketers go to that. So you'd make it a really good amount of people
So-
that would be interested.
And certainly, if we make this event, I will be sure to reach out and let you guys know that we'll be there.
Mhm.
I love it. Jessica, so I'm the facilitator for the Commission on Disability, so I answer all the phone calls. And
Okay.
sometimes, we get calls, we're just an advocacy agency. And we get phone calls, like it might be like somebody's looking for housing or they had problems with the housing they had and they have a disability and, maybe they feel like they're being discriminated against. I always refer them to court. Is that correct?
Yes. Yep.
Yeah.
Now,
Right.
again, with the third party phone calls, but you could always just give them our number and say, you know what?
I
this
don't,
is-
I don't call for them. I give
Yeah.
them your number.
Yep,
is what I
yep,
do.
that's perfect.
Mm.
Yeah.
No, we can absolutely help with issues like that. 90% of our calls right now are housing related.
I bet.
I'm sure.
That's tough.
Yeah. it's bad. Yeah.
There's no housing options out here, especially for accessible housing.
I was just gonna
Um,
ask about accessible housing. Do you have a list of like apartments or housing that's are accessible?
So we do have a housing list for everything on the Cape. And if it is a newer complex going up, 20% of their units have to be accessible. It's a lot.
Mhm.
Now, you
Um,
mentioned Cape, is that include Nantucket?
I think that I have one in Nantucket and one in Martha's Vineyard on that list.
Okay, thank you.
Sure. Any other questions?
I have a question again. Okay, so one thing that we did out here in Nantucket and we were like, the Commission on Disability is what was advocating for it and was accessible taxi cabs because we didn't have any accessible taxi cabs here in Nantucket. And so what they did was the town voted to put 4 more taxis in service, but they had to be accessible taxis. And then they went through the taxi list that we have here. And whoever wanted the accessible taxi, it had to be accessible. They had to operate they had to operate like 365 days a year. There was parameters involved in this. Now, when I've been to the Cape before, many times, obviously, I go off island almost every week or was. And I don't think I've ever seen an accessible taxi. I mean, I see
Yeah.
like the services, what's it called, it's an accessible white van and it begins with an
Yes.
H. I see that all over the
Yep.
place. But
Yep.
are there accessible taxis that like if I was taking somebody over to the Cape and I don't have an accessible vehicle, is there an accessible taxi that I can call to bring, the person in the wheelchair to like wherever I need to bring them to? Are you aware?
So, to my knowledge, with an actual taxi service, no, but we have the Smart Dart and we have the RTA.
You
So
have
the
what?
RTA, the Smart Dart, so it's run by the Regional Transit Authority. And it kind of functions like an Uber or Lyft. It's an on-call service, but it's an accessible on-call service.
And how do you, so how does that work, Jessica? Just could you explain how that works, do you know? Like,
So
I call
if
them.
you know
Oh.
that you're gonna be on the island and you know that you need to be picked up at the ferry terminal and you need to be brought to this address, you would call the day before and just say, I need a ride from A to B at this time, and then I need you to pick me up at B and take me back to A.
Okay, and what's the name of it again? Smart Dot?
The Smart Dart, yep, it's run by the Regional Transit Authority, the RTA.
Do you have
And there's
to,
always,
do you have to sign up for this service? I mean, do you have to like fill out an application and be pre-approved, or is it open to the general public like an accessible taxi would be?
yep, it's a public service.
So no application is necessary.
Nope. And then the
So-
regular transit bus, you can schedule those, or you can do the dial-a-ride, and those are accessible as well.
And so dial a ride is what now? What is
It's just
that?
you call the 800 number for the RTA service and just say, I need a bus to pick me up this place this time. And then they'll ask you where you're going. And I
Okay.
think it's like $3 a ride, so it's also affordable.
Okay, this is all through the RTA, right?
Yes, yep.
Okay, and so it's, you really have to make a reservation in advance. I'm just trying to get this, make sure I have these facts right. You have to make a reservation in advance. It's not as if I can just show up on like at 9 o'clock tomorrow morning and say, okay, I need a ride. Or
You
can
would
I?
have to call the day before, yes.
And do you have to pre-register for that?
No,
Because I think here you do. You have to have a card or something.
Here we do, yeah.
For our
Well-
own transportation, you mean on Nantucket? You have to sign up for it ahead of time.
And you need to pre-register, you need to be in their
Right.
system.
Yes.
Yeah, with the RTA, that's not something that they need.
Great.
It really is a public system service.
Do you ever get any anybody asking about accessible taxi cabs on the Cape?
I have people that call looking for accessible rides all the time, but
Yeah.
nobody I think has ever specifically asked me about a taxi.
Mhm. Just because the reason why that we did it here was because we wanted to, people that needed an accessible vehicle to have the same rights to an on-demand service as
course.
someone that, like the rest of the general public. So it was very important to us here in Nantucket to make that service happen, I was just wondering, is there any way that, this might be out of your jurisdiction, so to speak, but is there any way that, like the Cape could start having accessible on-demand service? I mean, like how, like the Commission on Disability did that for the town of Nantucket. And maybe it has to come from another like disability organization for it to happen on the Cape.
Perhaps.
But I just think that it's real, in 2023, I just think like Boston has accessible taxis, like
Mhm.
every place you go, any major city you go to the airports, they all have accessible taxis. But on the Cape, on all of the Cape, they don't have an accessible taxi. It just seems like,
Unfair.
totally not fair, and maybe not even in compliance with like what the law really says about
Mhm.
Mhm.
taxis having accessible taxis. I'm bringing it to your attention just because I don't know who else's attention to bring this to, And
Brenda,
No, that- it
seriously, I
makes
mean, I don't
sense.
know who to talk to about this, and I figure if I can start the conversation here, then maybe
Yeah.
it can go someplace on the Cape. Like maybe someone inside of Cord has like the appropriate contacts for something like this, but I just feel like the disabled community that needs an accessible taxi is not being serviced.
I do know that Uber and Lyft now have to have a
Yeah.
certain amount of accessible vehicles.
Okay.
But we don't have a lot of Uber and Lyft drivers out here on the Cape. When you get up towards Boston, sure, there's plenty of them. And public transportation, especially accessible public transportation, has always been an issue out here. But this is definitely to have those conversations. This is a good place to start because, myself and other advocates are members of other disability commissions on the Cape. And
Mhm.
we do go to town meetings. So town meetings would be a good place to bring this up. We do work with local state representatives where we can, get a little louder about it. So this is absolutely a good place to start that conversation.
How many do we have on Nantucket right now? Do you know? Taxis?
So there's actually 4 accessible taxi licenses, and this is gonna be in the update. And Mickey and I are gonna do an inspection of the 4 of them next week to make sure they're all operating an accessible vehicle, because I'm not saying that they're not,
No, exactly.
but there's 4 and if they're not operating an accessible vehicle, they have to surrender the license. And we put that license out there for someone else that wants to operate an accessible taxi. Mary Beth, you got something to say?
Just as a sidebar,
Wow.
you might be saying this after, he wants to know if he can go with you and Mickey. Of course, I would have to bring him
Check it out,
to check out the taxis.
make sure they're.
To make sure that everything's working, Augie?
Yeah,
Yeah,
that'd be great. It would be.
I think it'd be
helpful.
great.
That would be
yeah,
great.
I'd love
Exactly.
to.
yeah.
I'd love to bring them.
But, good, Mary. You know what, I think it's a really great idea.
Yeah,
It is a great idea.
Yeah, because
Brenda, do you have a
we
date?
know fans, we know.
No, we were thinking about Mary Beth, like, because Mickey's in town, and I want Mickey to be present for this, and so we were thinking like maybe next Tuesday morning, I was gonna reach out to the taxi, the people that have the accessible taxi license.
yeah,
And
do you know what day that is?
Yeah,
I can't see the calendar here.
23rd, I think, is a Tuesday.
yeah, I do, the 23rd.
The 23rd, you have a haircut that day, but it's later.
All right,
Yeah, I think think he's got his big hairdo that day, but I think that's later in the day. So yeah, that should be fine.
Okay, I'll
Yeah.
keep you posted. I'll put you in on the emails that I'm putting out, okay?
Okay, yeah.
How
Yeah,
often
so
do you do
Jessica,
that, Brenda?
Pardon me?
How often do you do the inspection?
You know, I haven't done it in a while, Jeanette, just because you know what my life has been like, you know?
Well, I know, I do,
Yeah.
yes.
And so, but in the taxi regulations, like Jessica, just so you know, like we put together a set of regulations for the accessible taxi cabs that the town adopted, and it's part of the taxi regulations. And one of them is that we can inspect their vehicle on a yearly basis. So we have the right to do that.
That's
And
awesome.
so we're gonna exercise that right this Tuesday.
Good for
Alright.
you guys.
But
Good.
Yeah,
I-
exactly. Yep, so
I
we'll see what.
used one for Jack to go to my granddaughter's wedding, God in heaven help me. Big difference. And
Not
it wasn't
really.
very, it was, I mean, they were kind and all, but the whole taxi was sloppy and dirty. So, I mean, but that was long before.
I know which one you're talking about, Jeanette.
Yeah, and I don't think it's on the road anymore, is
I
it?
don't think so either.
Okay, thank you.
Okay. Yeah, but, you know, Jessica, not to just dump this in your lap, but I do hope that this conversation goes further than just right at this
Yeah.
meeting, you know? I think it's important if Mary Beth and Augie want to go off island and they don't have to take their accessible vehicle, that they
Yeah.
should be able to get into a cab.
Yeah.
You know, to be able to go to the mall, to go wherever they're going, just to get a
Sure.
day travel off Cape, you know?
Yeah, and
Yeah,
that's,
of course.
that's something that I mentioned
Yeah,
to you, I
that's-
think, in a reply
that's good to
email,
take your car off.
Brenda, when you said that,
Yeah.
Jessica was gonna be at this meeting. But then in the initial direction
Yeah.
of the conversation,
Sorry.
peanut gallery, the initial direction of this conversation, it didn't seem like that's something that would be drilling down that far to taxis. But I'm glad that you mentioned it, because for us, yeah, this, you know, it's thrilling here and all, but once in a while, it's nice to just get off. And it's just a pain in the neck to spend, you know, 4.5, 5 hours on the boat. And we went off several years ago. We had a bad experience using the bus. And so for us and for him, if I'm gonna haul
Wasn't that
his
bad.
butt on
Wasn't
the
that bad.
fast ferry over there, I don't wanna be stuck in a situation where I'm waiting on a bus and no, you know what I mean? So, yeah, so definitely a taxi that like an Uber, you could reserve in advance is great. It just
Yeah.
adds a little bit of, you know, fun.
Yeah.
You know, let's go be mall rats, you know, for a couple hours, which there's no opportunity for here.
Idea of hell is that, so doing that.
Yeah, I think that even having, you know, the RTA and the services that they provide, you know, there could be better, there could be more.
Mhm.
You know, especially because, you know, the Cape is a larger area. You know, and what if somebody wanted to go from Ashby to Provincetown?
Right.
It's surprising though, because if I'm correct, my understanding is that like Barnstable County, Hyannis, I mean, there's a large population of elderly, no?
Yeah.
And I'm not saying that elderly means disabled. I'm elderly, since turning 60 apparently. But it just seems a little bit surprising, but maybe all these people are driving. And then sidebar to that, maybe these people shouldn't be driving. So, I
Yeah.
see a lot of those people here.
Yeah, I know, but they want.
And Jessica, I'm sorry, did I interrupt you, Augie?
No, it's okay.
No, he's saying, you know, they want to exercise their independence. 'Cause, like,
Yeah,
everyone knows, like
Yeah.
with their parents, it's the last
I
thing like
know.
your dad wants to give up
I
is his
know,
driver's
I
license,
know,
you
It's
know,
tough.
yeah,
it's tough.
Yep.
yeah.
I get it.
And you know, Jessica, when I was telling you the way that we did it on Nantucket, I'm not suggesting that that's the only way to do it, but I was just to kind of give you an idea how we started this whole, you know, how we got involved with it, because we saw the need, we went to the town, we helped the town write the rules that govern the accessible taxi cabs, and that's how it all went forward. There's other ways to do it, I know, but I was just kind of giving you an idea of how we did it here in Nantucket.
Sure, and you guys are doing great work. That's amazing. It really is. That's a huge change. So
You know,
from the start of the conversation to when it was actually like facilitated and you guys actually had the cabs working on the community, how long would you say that that took?
From the time that we started advocating for it and putting it together, it really wasn't that long of a process. The town just really embraced it. And I'm gonna say like from beginning to end, what, maybe like 3-4 months?
Wow, that's great.
Mm.
Mickey,
You're
Mickey.
muted.
Mickey, here.
Yeah. It took a while to get the cabs online too, because they,
Yeah.
they
Right.
find the cabs.
right, and yeah, and then people had to be wanting to do the accessible tax cab. So maybe the whole process, maybe it was 6 months, maybe not 6 months, people responded pretty quickly that they wanted to have a taxi license, and say like if they were number 200 on the taxi license, and the 199 people before them did not want to have the accessible cab, they had the opportunity to have the accessible cab and jump that line, so that was like really a benefit of, operating an accessible taxi cab. You got to get one long before a lot of other people got a taxi license, long before somebody else did, so.
That's great.
You know, if I can
And
just
that's
ask you,
incentive.
Brenda, because I know from New York City, from, well, all
Yeah,
boroughs,
they
not
got
just
tons
Manhattan.
of-
There's an app, so that we have, and so you can like, you can reserve, or you can just do it, an hour before or whenever you want it. But those taxis are pretty much going around doing their thing otherwise, if no one is requesting an
Yeah.
accessible taxi.
Is
So
that
I'm
what
just
it
wondering
is?
from a practical standpoint, if it's like the middle of the summer and, they're getting called into town, people are going to restaurants, this, that, the other. It doesn't seem to me that there would be any feasible way to give any priority to a disabled person, would there? I mean, no, it's probably just luck of the draw.
In the
but they
regulations,
exist, but it's a matter of whether or not you're lucky enough to get it, kind of. Oh,
Mary Beth, in the regulations, it states that if you have another fare, but say like if you're running a fare, and
Yeah.
then somebody with, that needed the accessible taxi called, they take priority. You finish that fare. they
that's
take
amazing. I
priority.
had no idea you guys did this
Yeah.
Wow.
all by yourselves.
Uh,
That's terrific.
I'm glad we're amazing you, Mary Beth.
Yeah. You never cease to.
Yeah. There you go. Once we do the inspection for the taxi cab inspection, and you'll be there, I'll send the rules and regulations out to everybody, so everybody's aware of them. I think that's a
Great.
good thing, right?
Sounds good.
Okay.
Excellent.
Okay, so we put something on your table.
Yeah, no, absolutely. And I will run with it.
Okay, thank you.
Yeah,
Thank you so
excellent.
much.
Of course.
Thank you.
Well, thank you guys for having me. It was lovely to meet all of you.
Thank you.
Jessica, thank you for taking the time
Yeah,
to
of
do
course.
this. Really appreciate it,
Absolutely.
I speak so highly of Cord here on this island, and it's just nice to meet someone that actually works for Cord and find out exactly what's going on.
Yeah. And if you guys have any questions, you have my email. Feel free to reach out anytime.
Thank you very much.
Thank you.
Thank you.
And hopefully I will see you guys at the fair, the health fair.
I like it.
Hey, that'd be great.
Thank you for that
Great.
information. That's great.
Thanks,
You're
Jessica.
welcome.
Good reason
Yeah.
for me to get out there. All right.
Yes.
Have a great
And
day,
enjoy
everybody.
our island.
Go to.
Yes.
Yes.
Looking forward to it. Bye-bye.
Bye.
Glad-
All right.
But don't come now because the traffic is really bad. So
Mhm.
come in October.
Not that bad right now. I mean, it's just the traffic really gets bad in like June and July and August.
It does, but it's really crazy this week right now. So
Yeah.
I think it's
Wine
the
festival.
wine festival. Mhm.
Oh,
Yeah.
Oh,
Thank
that's what it is. Okay.
Lots of
Right,
people out
okay.
there. Yeah.
What
Yeah.
festival is it?
The wine festival.
Wine.
right.
Oh,
Yeah,
that's
it
why all
starts
the
today.
tables are getting put up
That's
at the
right.
at
Okay.
Yeah, it
the,
starts today.
White Elephant.
Yeah.
They had the street blocked with two big trucks and And another thing, to try to get around children's speech, I was there this afternoon.
Yeah.
Okay, so let's get back to the agenda. That was very informative, very worthwhile.
Was. They have a great website. I looked up their website. It's really got a lot of stuff on there.
Mhm.
It's good, yeah.
How long have they been coming to the island? And can you tell me some of the services that they're doing, if you know, Brenda?
I had no idea they were coming to the island, Jeanette, you know, I just, they caught, it's, when I reached out to them to like do a presentation for us, they said, this is great because more or less, typically we don't have much to do with Nantucket. It was kind of like,
Right, that's what I was thinking. We're like
Yeah.
the lost child.
they might come out a couple of, no, Jessica said they come out a couple of times. I'm just not aware of it, you know, I mean, that, not that I should be aware of it either, but I think that now that we have a little bit more information from them, maybe we can be a little proactive about, you know, having them come to Nantucket.
Yeah.
You know,
Yes.
even like you said, for the health fair or whatever, like I think maybe we have to be a little proactive in getting them over here,
Mhm.
right? Instead of just,
Initiating it.
right, exactly. So I think that's just something we'll just have to do, Jeanette.
Yeah,
Yeah.
sounds good.
Yeah,
Hopefully it works.
I know, exactly. I think it will work. I think, you know, I do.
Okay, so on the agenda, we have the we need to approve, do we need to approve some minutes, Brenda,
Yes.
Yes.
back from November?
I put them somewhere.
I'll make that motion.
I'll second it.
Thank you. All those in favor, Mary Beth,
I,
Augie,
I,
Jeanette,
Aye.
Georgia,
I,
and I'm an I. Thank
Who
you.
seconded that? Was it you, Georgia?
I
no,
agree.
it was Mary Beth.
You're back.
Yeah.
Like it. Okay.
So, on the agenda, we have reviewed the commission's new description and statement. I think we're going to postpone that, Brenda, is that right?
Yeah, so Mary Beth and Augie came up with a really great one, and there was just a lot of stuff I wanted to kind of like bundle into this, like even like some of the descriptions we have, like just out there. And I really didn't get a chance to do it, but on the update, I was gonna tell you that Mickey and I are meeting with Libby and David Gray down at on C Street at the pump station. Because big sewer project going on, and David's gonna tell us about the sewer project and probably how that's gonna impact maybe the streets and everything. And about what they're gonna do work on the south side of Main Street, the sidewalks, and he's gonna discuss that with us. But he also wanted to address the commission with this too. So Mickey and I are gonna meet with Libby and David Gray on Friday morning at 8:30. And then he wants to present to the commission. So we're gonna have a meeting maybe next week. And so maybe after that meeting, like I'll have all this stuff together that we would like to kind of like review the descriptions, all this stuff, like what are we really doing as a commission? That's what we should really have like out there, what we're doing as a commission. I mean, other than the description, just other things that we have that are really outdated. Maybe we can go through all that at that meeting. I'll send it all out to you ahead of time. You have time to digest it. And then come in with your comments and we can make some decisions. How's that sound?
good.
Fine.
All
yeah,
right,
good.
I do have an update.
Go ahead.
Can I do that, Mickey?
Yeah, let's do it.
Okay. So. I'm just, you know, for a long time, like, things are like really slow and now things aren't slow at all. You know, lately, like the last like few months, we have just been jamming, but I did reach out to Pippin Anchor and they actually, I have to reach out to them again because Remain Nantucket, I emailed them about the accessible parking space at Pippin Anchor. They were all over it. This guy, Tim, who does that work, was supposed to contact me the following week. Did not, but I will, that's on my radar right now. Okay, my front burner, Mary Beth, okay?
that's great. And you know what? No worries. I go in there so much because Augie has become so obsessed with their sandwiches.
Oh,
And
yeah.
I love going in there. It's just such a cute place. They don't have a lot of parking. It's, I don't know if the one, if they ever were gonna have one, if it would be the spot out in the front. If so, sure, that's looking into. If it was gonna be anything out in back, honestly, in the summer, we would never even use it because it's like
Right.
entering Dan's Pharmacy's parking lot. You go in and it's an obstacle course. You don't know what you're that. So I try to go to Dan's just in my Jeep. And the
Yeah.
same thing is gonna be for me, at least during the busy season with Pip and Anchor. So this isn't life or
Well,
death.
you know, they
Still
should have
gonna
an
get his
accessible parking.
sandwiches.
Naomi and Chris want to have an accessible parking space.
Yeah,
Renee
no,
wants
they're
accessible.
adorable, yeah.
And the one, and we've talked about the one right out front, Maribeth, that's the
Yeah.
best accessible parking space. You don't have to deal with all the traffic.
So if and when it happens, it happens.
Okay, that's it. And the ramps, where so many people have been using our ramps, it's been so
Wow.
great. Yeah, it really has been. It's like, I have,
Oh, and Bob Miller, I hope, I know I spoke with
yeah,
them.
Bob Miller.
And
yeah.
we offered our van, I said anytime, whatever, because I know they were just bamboozled with the
Oh my
whole
gosh.
situation. But I
Yeah.
know she said you guys are old friends, and so
Yeah.
I hope everything's going well, yeah.
Yeah, so, and there was another gentleman who had a stroke over in Eel Point Road, and before they got the ramp built, we ramped their house for them, I mean, people are really aware of it, and I just have to let you know that we get so many thank yous for the use of these ramps,
That's
and I
great.
just wanna let the commission know that, this is just, has been such a really great program, and almost like Nantucket, people can't believe that Nantucket does this. They says no place else does this, so,
Yeah.
I think it's a really
love
wonderful
that.
thing that our commission got involved in.
So
Just want to let you know, it's not just the summertime anymore, and,
It's my, you give credit to the commission, but credit really goes to Brenda. She do
Definitely.
99% of that, if not all of it.
He lugs and
yeah.
tugs.
I use a two-wheeler these days.
You use a what?
I use a two-wheeler or a dolly, whatever you call it. I used to,
Oh, a
Yeah.
hand
Just to
truck.
lug it.
a hand truck, I do, yeah, I do, for sure. All right, so,
That's great.
so we'll end up having a meeting with David Gray about the sidewalks and maybe other things that Mickey and I discussed with him on Friday. But also the summer house, we're gonna have a meeting because the summer house applied for a variance, and Mickey and I are gonna go out and look at the summer house together. And I know it's a variance for their front porch, but anyways, I think there's a few things going on here that we just have to go out and see what's happening. And so that variance will come by I already received a copy, so it's something we're gonna have to discuss in probably the next very near future also, okay? And then we're gonna do the taxi inspection. Oh, and so Mass Office on Disability is doing this webinar that's free and open to the public about service animals, like, for the restaurants, for the hotels, for all the public spaces. It's for people that own businesses to know what the rights are for people that have a service dog and what questions they can ask and what questions they cannot ask. And it's also for the people that have service dogs, that they know like what their responsibility is in this too. But anyways, I reached out to the Chamber of Commerce, the Visitor Service Center, the town. So the town's has an email business list. They're sending it out to all the businesses. Chamber of Commerce put it in their newsletter. I think that just came out recently. It's on their calendar. They're reaching out to their members for it. Visitor Services is gonna do whatever they can do to get the word out there also. I would love to get out to, I don't have any idea how to get in touch with the Nantucket Lodging Association because their email address is none, but I would love to get out to restaurant groups and to the lodging. I think this is where it's like really critical information for people that work in the restaurants and lodging, and I'm not exactly sure how to get it out to them yet. But
Wouldn't the
if
chamber
anybody has
have-
any ideas,
Wouldn't the chamber have a number for who's in charge of the lodging right now?
yes, if you're a member of the Nantucket Lodging Association, you have to be a member of the chamber. So the chamber has sent them that information,
Okay.
so.
All right.
they took care of that for me, but just like this, I think there's only 31 places that are on the lodging. Anyway, I wouldn't, if anyone has any ideas how I can reach out to a restaurant group or a hotel group, I would love it. I can go restaurant by restaurant, and I will do that if I have to, no problem, like get all their email addresses, but just throwing it out there, I think it's really important information. I get calls several times a year about people not being treated properly with their service dogs because like people in the public sector, they are unaware of what laws govern service dogs, and this is going to clarify everything for everybody. So I signed up for it. It's June 7th, I think at 1 o'clock. So I think I might have sent you guys an email. We got it. If not, I'll send it if you guys want to join the webinar. I think it's going to be really great. So just throwing that out there.
Oh,
And
interesting that
also,
there's-
okay, so now community sailing.
Oh.
Diana Brown reached out to me because community sailing they partner with STARS, the Nantucket Star Program. And on Wednesday mornings and Friday afternoons, the people or the people that are registered with the STAR program, they go to Nantucket Community Sailing for whatever activities are involved, whether it's sailing lessons, whether it's just a sailing event, I'm not exactly sure, but it's on Wednesdays and Fridays. Diana said that it's very difficult to get a parking space down the jetties, and parents or caregivers just can't drop off these kids and tell them to go down that path, and they'll meet them because a lot of the kids, Diana said, have emotional needs and just need to be escorted, and they need to be escorted, and eyes have to be on them all the time. So what we came up with was put in 2 parking spaces right at the path that leads to Jetty's community sailing center area, and put signage up saying Nantucket Community Sailing only, Wednesday mornings from 8 to 12, Friday from noon to 4. And Diana's creating a parking pass that says Nantucket Community Sailing Jetty's parking pass. And everyone that parks in there has to display that pass. So that's going to go before traffic safety tomorrow, Mickey, right?
Mhm.
Yep. So hopefully they'll get it because Diana says there's a real need for something like this. It's been very difficult for the people involved in STARS and the caregivers to get their loved ones down to Jetty's Beach.
You know,
Just
Brenna,
go ahead, Mary. Go ahead.
I'm just having a thought on the restaurant thing, because I don't really know on like a city by city basis if there is like some, sort of like restaurant group that.
Right.
There used to be,
restaurants
for sure.
I-
There used to be.
Well, okay, but I don't know from Boston or New York or whatever, I
Yeah.
don't know if that exists. But I'm just thinking, and since the Inkies restaurant guide just came out, and it seems that what we're saying is it's every man for themselves, and it seems only like a fraction, or there are a lot of new restaurants that aren't even in there. I know they have to pay to be in there, but is there a way to try to like force the issue? I mean, they've got their dress code and we accept, American Express, this, that, the other, the whole thing. Is there a way to force the issue of, I guess you can't because it's ultimately advertising, but to try to request that accessibility and maybe service dog accessibility become one of those items that's on that column on the left? I've noticed that a lot of them are going for, and good for them, kind of like a newfangled kind of not following that format with all the answers to the questions on the left-hand column. But I wonder if there's a way just to sort of, at least the ones that are in the Inky Restaurant Guide, try to suggest, can't we add this, because I'm sure that there are obviously a lot of people. I know that in the booklet that the commission had put together that there are accessible restaurants, but what about making the restaurants themselves accountable to answer for it? And if they're putting it out there and if they're signing off on it and putting their phone number, then, kind of let them deal with it. If
Yeah.
people get there and find out that in fact, that's not the case.
Do you
I'll look
mean
into this,
with
Mary Beth.
handicap, being handicap accessible?
Yes, I'm starting with accessible. I mean, it just, my mind started thinking about it when Brendan mentioned the service dog thing. But starting a step before the service dog thing, just accessibility. Because I know for us, it's something that it's always try, we have to show up to find out what really the situation is. And so I don't know, maybe, and again, I know this can't really be like a force thing. Because ultimately it's just advertising and it's whatever they want to do, apparently. But maybe kind of requesting,
Oh, put it
suggesting
in there.
in a nice way that,
Mhm.
that accessibility
Yeah, it's listed
becomes
in
an
there.
item that's listed, you
Yeah.
know, along with, do you do takeout? Yes
That's a
or
good-
no,
that's a
whatever.
good- that's a good idea.
And just have that added in there. And then if to take
Yeah.
it one step further and
You could-
maybe people, I'm sure
yeah.
they don't even want to address the
Yeah.
accessibility
Yeah.
issue for humans,
Yeah.
right?
Well,
So they
let's-
might not care at all
Yeah.
about like, you
Well,
know,
let's say if
pet
they wanna make reservations.
issues. But maybe that's like a place to start and
Yeah.
suggest to the Inky that they make it,
Yeah.
you know, I don't know, am I going too far?
Are you
No,
suggesting,
no.
Mary Beth, that they
I don't
put
know.
this in their restaurant guide? Is that what
Yes,
you're? Okay.
yes, the thing I just picked up at Stop and Shop that is almost gone. Every other things can sit there forever, but everybody grabs that restaurant guide right away.
Yeah, well.
Yeah.
One other thing too is definitely important for them to say that it's handicap accessible restaurant, cause that way, you
Well,
know,
That's what I'm saying,
Well,
like,
well,
but it's,
what we're trying to say is it makes it for, that you could tell a friend about it who's in a wheelchair, and they can go ahead and make a reservation in advance, knowing that it's
right,
handicapped.
but I'm suggesting
Yeah, I know.
that what if it was
Yeah.
proposed to the Inky?
Exactly,
Because
yeah.
they're in charge of
Exactly.
that restaurant
Mhm.
guide. Then
Well, I'm
maybe
just saying,
it be
I'm
added
just saying.
as one of their, they must send out
saying
like
they're-
a
they-
questionnaire where you put in your
Well, I'm
hours
saying
of
fill it out.
operation, the payment accepted, smart
Right.
casual, show up in your flip flops
Well,
and add accessibility as an item.
I like it.
And one step further
well, what I'm
would
trying-
be whether it, you know, would include service dogs or service.
Yeah.
I'm assuming it's just dogs and not service flamingos. Like people try to bring their comfort flamingo on a plane, but
A
yeah,
comfort animal and a service animal is completely different.
right. Cause yeah, we all,
Yeah,
yeah.
so, I think that's a good idea, and,
Yeah.
you know, maybe even like, Mickey, what do you think about putting an ad in the paper in the Inquirer Mirror
Or what?
for the service
Gotta do it
dog?
for free first.
An ad, or you mean like a letter to the editor?
Oh, we could do that, right?
Say that
Brendan,
again.
But that might be, that would put them on, I think, the attorney and me, that would put them on the defensive. That might be better to ask first and get a no.
Mean,
As
ask what,
We
Mary
said
Beth?
a little bit of sugar will go further than, yeah, do you know what I mean? So to start out with, hey, what do you think about this, Inky? And if they're like, stay out, you know, if they pay, they can put in whatever they want, we can't get them to address that, because I'm sure it opens up a whole Pandora's box or can of worms, because I'm sure a lot of them, unless and until they're calling you because their restaurant changed ownership and they want something grandfather because they don't want to make a change in the restaurant, they don't want to be accountable, they don't care or know what the ADA is unless and until they have to.
Hmm.
Well, I'm getting a little lost in the conversation. Mary Beth, are you suggesting that we try to encourage more restaurants to become physically accessible?
No, I'm just saying, just in the restaurant guide, you know, the restaurant guide,
Yes,
that the glossy thing that the it just like hit the certain, that thing.
yes. So that's something that I think that we would talk directly to the Inky about instead.
Exactly. Oh, that's what I'm saying.
What you
Yeah.
saying,
I think
That's
that they would do it personally, because so many of the restaurants, there are a lot of accessible restaurants out there. And I think that they would do it I do think that they would add that as a line item, so to speak. You
I
know? Because the visitor service center, if you go on their webpage, and you go on to the restaurants, they have a wheelchair symbol identifying each restaurant that is wheelchair accessible. So I think it's something that the Inky would do.
Yeah, why don't you just contact the Inky, Brenda, and see what if they're willing to do.
Yeah, I will. I
Yeah.
will.
Yeah.
Okay, so All right, so then, oh, and so that's what the community sale, so hopefully we get those two parking, they get to those two parking spaces. So the valet parking company downtown has two scooters, accessible scooters for rent, and they will drop it off at, you know, at your house, or they'll drop it off at the boat or whatever. They have two different scooters, so I let the Chamber of Commerce and the Visitor Service Center know that also. And so just to make everyone aware of it, that does exist here in Nantucket, in case you have someone that's visiting that could benefit from scootering around versus walking around, you know?
Great.
Yeah, I thought that was really good. Okay, Mickey and I, the Pearl and the boarding house invited us to do a walkthrough before the Pearl opened. About all the things that we, you know, discussed during the meeting that we had on Zoom with the representatives of the Blue Fly Group for the Pearl. And they did everything that we asked, right, Mickey?
They did, yeah.
Yeah.
Yeah, I mean, they couldn't do anything upstairs, unfortunately, but they didn't, you know, they have their lift from the outside in the back. And the inside is accessible, there's an accessible bathroom, so it's really all they could do.
Yeah, and for the accommodation, remember they have 3 private dining rooms on the upper level, on the second level of the Pearl, which is not accessible. So the accommodation was they could either go to they could have it at the chef's table, or they could have it in the dining room, and they would partition it off. And they actually have they have a place where they can put that curtain to partition off that section of the room. So and they're going to put when somebody comes in to use the lift, there's actually a camera that is going to be that the hostess will be tracking on the iPad at the hostess stand, and the camera will you can see like from entering the lift to when they get off the lift. And when they get off the lift, the plan is that we talked about, the hostess or host goes to meet them at the door the same way everyone else is greeted when they come in that front door of the Pearl. And yeah, they went through everything with them, and everything that we asked them to do, they have done. And they invited us back to make sure that we were happy with everything before they opened.
That's great.
Yeah, I thought I really liked them being proactive about that.
No,
Okay, Mickey, you want to talk about Brent Point?
Sure, we yeah, so they had gotten the approvals to make and they were required to make a lot of those doors in at least the first or one of the units, number 6 probably, more accessible. They had to widen a bunch of doors and put in a bunch of door openers. They had a problem with one particular guest room door because there was, to make it wider, because there was a stairway in the way on one side and a big physical post in the wall on the other side. So they said they couldn't make it any wider, but when I looked at the drawing and the photographs, it looked like they could maybe make it a little bit wider. And Brenda, I suggested that they look into it further to see if they could widen it. And I think the result was they were just going to look into it and get back to us. And I don't know that we've heard back from them.
I have not heard back from anyone, but yeah,
Right.
on that.
So
But all the other doors that they said they were either gonna widen or put a automatic door closer on, they did.
Good.
Yep. Yeah, and then Rocky Fox is gonna be a new member of our commission.
Great.
Right.
And
Great.
yeah, I think he'll be great too.
Mhm.
So that's all I got for you.
Well,
Right.
not to cut things too short, but I've got to run unless somebody else has anything else that they wanted to bring up today. We're going to be, Brenda, you said we're probably going to be meeting within a week or two.
I would think so, yeah, just because
Okay.
after we meet with David, we can set something up.
Right.
And Mary Beth, I'll get in touch with you about the
You
taxi.
just let us know. Yeah, that's great.
Oh, yeah, I will.
Where will it be?
Probably I'm gonna see if I can do it at the Salt Marsh Center, because that's where my desk is. I love it there. they're great.
Oh, yeah.
Yeah.
Yeah, he used to volunteer there. He was the
Yeah.
technology guy and
I
then
miss
COVID
going there.
happened. Yeah. You miss going there?
Yeah,
Yeah.
Mhm.
He used to
Okay.
help people with their iPhones and stuff.
yeah.
Cool.
Oh,
Good to know.
I
Oh,
know.
yeah, we hung with Laura
Yeah, I
and
can help you.
Ginny.
Yeah.
Yeah, on Tuesdays we used to go, yeah.
Yeah.
Aha.
And they do a great job.
Yeah.
They do. They
Okay.
really do.
They
Yeah.
do. That's an active center.
Yeah.
Yeah,
Yes.
a lot of people there for lunch, we observed.
Yeah.
And do you know what they do? They do movies on Monday afternoons now at
Oh,
4
that's
o'clock.
cool.
Yeah.
It's great.
And they've got popcorn and potato chips and drinks, and it's great. And they got a lot of old folks there.
All righty.
Okay,
Tomorrow I'm
so
gonna be seeing a movie. Yeah.
Are we done, Mickey?
I think we're done unless anybody has anything else, but I think we can,
Yes, it's-
not seeing anything.
No.
No, we're good.
So do you
We're
want a
good.
motion to,
It's-
Adjourn.
I'll second. I second that.
Okay, thank you both.
Okay.
All those in
Take care.
favor?
good to see you,
Aye.
Mickey.
Bye.
Okay, bye-bye. Thank you.
Bye-bye.
Bye.
Bye-bye.
Bye, everybody.
Bye.
Bye.
Bye. I'll push N down there, the red.
Okay, and
We